Hello, I'm Dali, a hypnotherapist, pharmacist, and research student at the University of Queensland. This is Lucy, a pediatric burns patient who is feeling powerless, distressed, and scared of burn care procedures, which reduces her compliance, increases her pain and suffering, and delays her recovery. This can be Lucy, cooperative, trusting clinicians, confident, relaxed, and empowered, which increases her comfort, reduces her pain, fastens her recovery, and makes her feel better. How? Hypnotherapy for procedural pain, itch, and state anxiety in children with acute burns. Burns are common childhood injuries and thus may affect children we know. Like Lucy, these children experience pain, anxiety, and itch due to burns and related treatment procedures. Inadequately treated pain, anxiety, and itch can exacerbate each other, delay recovery, and cause chronic biopsychosocial problems that can negatively affect children's psychological well being, school performance, social functions, sleep, and pain management. In contrast, reduced pain, anxiety, and itch can enhance comfort, fasten recovery, and reduce pain and distress. Thus, children with burns require effective and adequate treatment of their post-burn itch, state anxiety, and procedural pain. Despite popularity and benefits, itch and pain medications can be limited by side effects, contraindications, lack of tailoring, high cost, and inability to address all pain determinants. Plus, there is lack of consensus on optimal doses and regimens to use in children with burns, which can minimize medication's efficacy or exacerbate their side effects. In contrast, hypnotherapy can be tailored to diverse settings and populations and can address all pain determinants. Children may be more receptive to hypnotherapy due to higher hypnotic suggestibility, wide imagination, and motivation to attain new skills. Hypnotherapy is supported by evidence of effectiveness and superior benefits for procedural pain and state anxiety in comparison to other psychological interventions. The utility of hypnotherapy for children's itch-related scratching reflex and distress suggests potential utility in using hypnotherapy for children's post-burn itch. Thus, hypnotherapy appears to be promising as an adjunct to pain and itch medications in children with burns. Yet, research is lacking and more effectiveness studies are required in pediatric burns. So, what is hypnotherapy? Hypnotherapy refers to delivering hypnotic suggestions in a specific sociocultural context to elicit sensory, perceptual, cognitive, and behavioral alterations for therapeutic purposes. Contrary to misconceptions, a hypnotized person is aware, in control, and able to remember what occurs during the session. Hypnotic responsiveness is not a sign of weakness, but of higher hypnotic capacities. Hypnosis differs from sleep, simple compliance with suggestions, imagery, meditation, relaxation, and pathologic like states. Hypnotic analgesia is not due to a placebo effect. Despite acceptance by medical associations and evidence of utility, there are still myths surrounding hypnosis, as shown in surveys including parents of hospitalized children, which may influence children's acceptability of the intervention, viewing the relation between parental and child attitude. In addition, pediatric burn setting may pose challenges to adequate delivery of the intervention and pain treatment due to short pre-procedural time, repeated painful procedures, and the unique biopsychological characteristics of children with burns. Thus, examining the feasibility, acceptability, and implementation of hypnotherapy are important before conducting further effectiveness trials. This study aims to examine the feasibility, acceptability, and implementation of hypnotherapy for children's procedural pain, state anxiety, and itch, using a prospective observational mixed methods design. Children presenting to Queensland Children's Hospital for their first burns dressing change will be included if they fulfill all these inclusion criteria and excluded if they present with any of these exclusion criteria. Reach referring to willingness of families to participate, and adoption referring to clinicians' willingness to participate will be assessed respectively by families and clinicians' participation rates. Acceptability will be assessed by attitude and satisfaction ratings toward the intervention and study procedures. Effectiveness of hypnotherapy will be assessed by measures of pain, itch, anxiety, behavioral distress, physiological stress, wound healing, and safety. Feasibility, referring to success of delivering hypnotherapy and study procedures, will be assessed by adequacy of resources, potential interruptions, and time measurements. Implementation, referring to the extent to which the intervention and study procedures are delivered as intended, will be measured by retention rates, intervention fidelity measures, and reporting of modifications or adaptations to the intervention manual. Included families will be offered a pre-hypnosis interview for collection of information on children's preferences and influencing factors for outcomes, explanation of hypnotherapy, and establishing rapport with the child participants. Following hypnotic suggestibility screening, only children with medium to high hypnotic suggestibility will be included to receive hypnotherapy during dressing changes until their wounds heal. Data on pain, anxiety, itch, as well as pulse and saliva samples will be collected at baseline and following interventions. Satisfaction ratings and feedback will be provided following interventions. Itch will be assessed starting from the third dressing change. During the first dressing change, as part of hypnotic suggestibility screening, standard test induction and suggestions will be provided for participants. Those who are excluded will be given suggestions to emerge out of hypnosis, and included children will be offered therapeutic suggestions for analgesia, anesthesia, and itch until the end of the session. In following sessions, the induction will include eye fixation, pleasant imagery, abbreviated progressive muscle relaxation, faster and deeper breathwork. Intensification techniques will include visualizing, counting, and ideomotor tests. Suggestions will be phrased directly or as metaphors. Hypnotic suggestions will address cognitive, affective, and sensory pain determinants for analgesia and anesthesia. Post-hypnotic suggestions will promote positive conditioning, address the post-burn itch, and teach children self-hypnosis. The sessions will be accompanied by music, and children will be provided with tape recordings of self-hypnosis to practice at home. The intervention will be tailored to children's preferences and factors that may influence outcomes and that can be child-related, such as cognitive capacities, and pain-related um, perceptions, cognitions, and emotions, and attitude toward hypnotherapy, or related to the context, such as parental presence and available time. The proposed study is a first step towards further research investigating hypnotherapy in an acute burn setting, with the ultimate aim of wider clinical implementation. Examining the feasibility of hypnotic suggestibility screening and tailored hypnotherapy using a mixed methods approach with multiple sources are unique aspects of the study. Special thanks to my supervisors, Dr. Vince, Dr. Devon, the painters, and thank you for listening. You can follow me on my Instagram account and my Twitter account.